This is the week, I guess, when we would begin to see the impact of holiday gatherings in terms of COVID cases. But in Quebec, Michael just talking about the tough measures that are already in place there, including that curfew. What are you anticipating in Quebec?
Well, I think we are going to see continued high case counts. Now, the big issue that we have is that because it's hard to get access to a PCR test, those case counts are likely underestimates. But we're likely going to see high case counts at least for this week. I think the hope is that as we get into mid and into later January, that the situation stabilizes and case counts start to go down as we start to see the impact of the public health measures that were put in place, including the curfew. But it'll take some time before we start to see the benefits of that. So hopefully the situation stabilizes and starts to improve over the course of the next month.
Something that is in the upward direction is the number of hospitalizations in Quebec, Dr. Labos. Again, Michael just talking about that, and particularly the measures that Quebec City's hospital network has announced as of Wednesday of this week, postponing half of its surgeries and medical appointments to enable it to transfer staffers to deal with COVID patients in hospital. So the number of people in hospital in the province, 1,231, which is up, 162 in ICUs. Again, that figure to watch. As far as hospitalizations and that number, what is concerning to you there, and what are you seeing in Montreal?
Well, I think what's concerning is that the number is going up. Remember, at the beginning of, or sort of late fall, early winter, everyone, the case counts were going up, but people sort of lulled themselves into a sense of being reassured because they said, well, the hospitalizations are low. The problem with hospitalizations is that they lag the increase in case counts, and so we're seeing exactly that right now. Case counts shot up because of the Omicron variant, and now, a few weeks later, hospitalizations are starting to creep up again. So, not even creep up, they're starting to shoot up in some cases. So, when the hospitalizations go up like this, that puts significant strain on the healthcare system, and that's why you're seeing the cancellations of a lot of non-COVID related stuff. If you want to free up hospital beds, the fastest way to do that is to cancel surgeries and other procedures, because then you have less people coming into the hospital for other reasons. It frees up staff to be used in other places, and you're going to see more and more of that. The problem with this strategy is that over the long term, it just makes the wait list for a lot of these surgeries get longer and longer, and it was already long because of COVID, and now it's going to become even longer the more of these surgeries that we have to end up canceling.
Definitely something we're going to continue to talk about through 2022. Talking about cases being undercounts, talking about hospitalizations and their numbers and their direction as being an indicator that's significant to watch. Can you explain to us the positivity rate and why we should keep an eye on that? Because that might be something to indicate whether things are increasing or indeed starting to peak and wane, right?
Right, yeah, so the positivity rate is one of the things we look at. It's basically the number of positive cases divided by the total number of tests that are done. So if you test 1 million people and 1,000 of them are positive, that's a positivity rate of 0.1%. So the more people who are getting COVID, the higher the positivity rate goes. And, the harder it is for people to access tests, the more high-risk tests you do, the higher the positivity rate. So when there's a big demand for tests because there's a lot of COVID, the positivity rate shoots up, because the numerator shoots up and the denominator shrinks down. So following the positivity rate is another way to get a sense of what the burden of disease is in the community. As COVID slows down, you'll have fewer and fewer people testing positive, but it'll be easier for people to access tests because the demand for tests will be low. So the positivity rate will decrease, and that'll be, I think, a useful indicator in conjunction with all the other stuff, but it'll give us a sense of how bad the COVID situation is, because you can't rely on just one number. You sort of have to look at everything, and then that gives you a more global point of view of what's actually happening out there.
Okay, I'll remember to keep an eye on that as we speak further through the year, because in Ontario and Quebec right now, that positivity rate is either 30% or almost, in Ontario's case, almost to 30%. So that's very high. So we'll watch to see which direction that moves as the year goes on. Something else that we're hearing about in Manitoba, in Alberta, and in British Columbia, measures in place, Dr. Labos, to reduce the period of self-isolation for people who've tested positive. They're cutting it from 10 days to 5 for people who were positive if they're fully vaccinated and they have no symptoms. Now, what is the logic there behind that move, do you think, and does it wash with you?
So the logic behind it is that when you get sick, the further away you get from the infection, the less infectious you are, the less likely you are to infect somebody else. So you're definitely more infectious during the
Just a quick
first 5-day period than you are during the second 5-day period, right? So that's the thing. So if you can isolate for the first 5 days, during the second 5-day period, if you have no symptoms, you've been fully vaccinated, it's very unlikely that you'll go on to infect people. But the risk is not zero. So I think if you have the luxury to self-isolate for a full 10 days, again, based on how bad the situation is now, probably a good idea to do that. But if you have a critical job, like you work in healthcare or something like that, if after the first 5 days you are completely fine, you've recovered, and you've been fully vaccinated, it's probably a reasonable thing to do. And I think you're seeing the shortening of the isolation period as a response to the fact that there is such a shortage of healthcare and other essential staff. So this is sort of a compromise between the ideal and the practical, and the realization that sometimes we have to do what is necessary to keep the system functioning. So that's sort of the rationale behind it.
It's interesting. I mean, this was CDC guidance out of the United States doing something similar. We just heard yesterday from Dr. Anthony Fauci in the United States saying there was a lot of pushback from health experts to making that change. And so they are thinking there may be a tweak to the guidance from the CDC in the next day or two to, yes, go to that 5-day period, but to add a negative test requirement before you can end the isolation. So you do all of that, you're not symptomatic, but there has to be a negative test as well. Do you think that might be something that people might be looking for here?
Well, it'll certainly make it easier, of course. The problem now is that it's very hard to actually get a test. So that's where you see the situation. That's the problem. The worse the situation becomes, the more things start to unravel, and the harder it is to do things, quote unquote, properly, right? It's not wrong to say 5 days and test negative. It's just that now it's going to be practically very, very difficult. So for now, during the acute spike of the Omicron wave, again, if you have the ability to stay home, and in Quebec and Ontario, where most people are working from home now, really just stay home for the first thing, self-isolate, play it safe. Afterwards, once things get better, we can certainly look at whether a shortened isolation period is reasonable. And I think 5 days with a negative test, if you're asymptomatic, that's not an unreasonable thing to do, because you're most infectious during the beginning of the illness, less infectious afterwards. But again, just because if it's necessary, maybe you could shorten it. But there's still an argument to be made for playing it safe. And for most people, if they have the luxury to do so, doing it for a longer period of time might also not be a terrible way to go.
Dr. Labos, thank you very much. Really appreciate it. Our first of many conversations on this third calendar year of the pandemic. Thanks, Dr. Christopher Labos.
My pleasure. You take care.